If you've ever spent much time with a 2 or 3-year-old, you know that temper tantrums are pretty normal in childhood. I mean, kids can't express themselves well. They're frustrated, they're angry, they feel in the present, and they lose control of themselves. Many times they'll lay on the floor, many times they'll make a scene in a store. Whatever the cause, they're trying to get their parents' attention. I'm not happy. Now, when temper tantrums happen in adults, especially your partner, it can be humiliating, embarrassing, and scary if it happens with them in an enclosed situation like an airplane or some other kind of a public place. And you may ask yourself, do adults really do that? Yes, they really do. And as a matter of fact, since the pandemic, we've seen more adults losing control of themselves. Now, if this is your partner, you cannot tolerate this and you should not enable it. Don't make excuses. Don't tell people they were tired or they worked all night or whatever, because the more you enable this kind of behavior, the more you're making it likely that it will continue to happen. And it's scary to people, and it's actually illegal. It can put others in harm's way. There are many kinds of adult temper tantrums, but most of the time they can be categorized into 3 specific areas. The first of these is the total meltdown. This is when you see car rage and you've seen other kinds of, like in a store, someone will start yelling, they'll shake their fist, they'll honk their horn, they'll do whatever they need to tell you they're unhappy. Many times they'll roll down the window and scream at you. You've seen this in restaurants. You may have seen this in grocery stores. These are all areas people can get a lot of focus because they're public areas. Secondly, the silent seether. The silent seether, basically, what they're trying to do is tell you they're unhappy in a passive aggressive way. So they may slam a door, or they may huff off, or they may hit the wall. They don't ever use their words. Most of the time they don't use their words. They use their body to slam up against something, or they'll use a door of some type so they can make a loud noise, either exiting or entering. And lastly, it's the moaner. The moaner is the one who constantly blames others, and they're hurling insults, and they're just like sighing and making all these noises. So it's obvious they're upset. But once again, they're not telling you exactly what's going on or how they're feeling. You need to interject if you can, especially if this is your partner, because you need to have a plan. I have a 5-part action plan that I think is going to help you. The first of these: assess the situation and decide whether or not it's safe to engage. If they're just screaming and they're hollering, more than likely nothing's going to happen if you engage, except you're going to get yelled at. So it's probably wiser to walk away. This is especially true if you don't know this person. If you assess it and they're somewhat calm, then you can go into the second stage and you can respond, but do so calmly. What works best here is if you tell them what you see. I can see you're really upset. Can we talk about that? Can you tell me how you feel? The more calm you are, the lower your voice, the better that's going to come across. Thirdly, don't take anything personally. If they start to blame you, put up an internal shield and tell yourself it's not about you, because it's not. Many times if you just let them say that and vent, it'll help calm them down. Fourthly, keep yourself safe first, and your child. If they're really going off and they're threatening or hurling insults, it's important that you get away from there and you take your child. If it's an airplane, do not interject. Anything you say will probably escalate it, and it's not a wise choice. And lastly, decompress afterwards and make a plan. Decompressing means you go into your breathing, your calming down mode, and then you tell your partner very directly, we are not going to have this in our relationship. You have a problem. You're going to need counseling. If you need me to go with you, I am happy to go with you, but mostly you need treatment for this. You are not in control with what you're feeling. You need to be able to talk about what you're feeling. And until you're able, this relationship does not feel loving does not feel supportive, and it does not feel like a safe place for myself and our children. End of topic. Do not enable it. Do not allow it in your home.